Hello, welcome back. Today we're going to talk about our epilepsy drugs. So, starting with benzodiazepines. Benzodiazepines are going to be used for status epilepticus. Their mechanism is to increase GABA A activation. Side effect, we're going to have sedation, tolerance, dependence, and respiratory depression. So we want to remember that we're going to also use it for eclampsia seizures, even though first line is magnesium sulfate. So benzodiazepines are status epilepticus, increasing GABA, and side effect sedation, also for eclampsia seizures. Moving on, carbamazepine. Carbamazepine is going to be good for partial seizures, okay, focal seizures, tonic-clonic seizures, okay, and they are going to block sodium channels, okay? So remember, carbamazepine blocking sodium channels. What are going to be the side effects? We're going to have diplopia, ataxia, blood dyscrasias like a granulocytosis, aplastic anemia, liver toxicity, teratogenesis like left lift or palate, spina bifida, induction of cytochrome P450, syndrome of inappropriate ADH secretion, and Stevens-Johnson syndrome. It's also going to be first line for trigeminal neuralgia. So remember, carbamazepine are partial and tonic-clonic seizures, blocking sodium channels, and also first line for trigeminal neuralgia. Moving on to ethosuximide. So ethosuximide is very good against absence seizures. And how is it going to work? It's going to block thalamic T-type calcium channels. We see that ethosuximide can cause fatigue, GI distress, headache, itching, and urticaria. And we can have Stevens-Johnson syndrome. And they give acute pneumonic, sucks to have silent absence seizures. So basically, bottom line, ethosuximide is for absence, blocking T-type calcium channels, and we can have this fatigue, GI distress, headache, maybe Stevens-Johnson syndrome. Okay, then we have our gabapentin. Gabapentin is good for partial focal seizures. And the mechanism of action is primarily inhibiting the high voltage activated calcium channels, designed as a GABA analog. Okay, so basically we see that what happened is gabapentin was designed as a GABA analog, and the way it's actually working is inhibiting these high voltage activated calcium channels. Side effects are going to be sedation and ataxia. We're also going to use gabapentin for peripheral neuropathy and postherpetic neuralgia. So just remember that we're using carbamazepine for trigeminal neuralgia, and we're using gabapentin for peripheral neuropathy and postherpetic neuralgia. Just remember. Okay, so lamotrigine. Let's talk about lamotrigine. It's going to work on our partial seizures, on our tonic-clonic seizures, and on absence seizures. How is lamotrigine going to work? So lamotrigine works by blocking voltage-gated sodium channels, inhibiting the release of glutamate. Side effects can be Stevens-Johnson syndrome and must be titrated slowly. We can also have hemophagocytic lymphohistiocytosis. Okay, that's a black box warning. So that's it. So lamotrigine, just remember that it's good for all types of seizures, more or less, and it's going to block voltage-gated sodium channels, inhibits the release of glutamate, and remember Stevens-Johnson syndrome. Okay, moving on to levetiracetam. Levetiracetam is going to be good for partial seizures and tonic-clonic seizures, okay? So levetiracetam has an unknown mechanism of action. Maybe levetiracetam modulates GABA and glutamate release, or it can inhibit voltage-gated calcium channels, but in general, mechanism of action, unknown, and they ask about that. So what are the side effects? So with levetiracetam, we can have neuropsychiatric symptoms like personality change. We can have fatigue and drowsiness and headache. Okay, so levetiracetam, we said partial tonic-clonic, unknown mechanism of action, and neuropsychiatric symptoms. Moving on to phenobarbital. So phenobarbital is going to be good for our partial seizures, tonic-clonic seizures, and status epilepticus. It's not efficient against absence. So how is phenobarbital working? Mechanism of action is going to be increased GABA action. Side effects are sedation, tolerance, dependence, induction of cytochrome P450, cardiorespiratory depression, and it's going to be the first line in neonates. So remember, phenobarbital. So phenobarbital is increasing GABA, can cause sedation, first line in babies. Moving on, so talking about phenytoin. Phenytoin is going to be useful in partial seizures, tonic-clonic seizures, and status epilepticus. How is it going to work? It's going to work by blocking sodium channels, and it has zero-order kinetics. So we want to remember a lot of side effects for phenytoin. First of all, it's a P450 inducer. You remember we just spoke about phenobarbital, and phenobarbital is also P450 inducer. So both phenytoin and phenobarbital induce P450 enzyme. Phenytoin can also cause hirsutism, enlarged gums, also called gingival hyperplasia, nystagmus, yellow-brown skin, teratogenicity, okay, like fetal height and tone syndrome. We have osteopenia, inhibited folate absorption, neuropathy. Rare side effects can be Stevens-Johnson syndrome, DRESS syndrome, drug-induced lupus. Toxicity leads to diplopia, ataxia, and sedation. So what do you want to know about phenytoin? Phenytoin is pretty much good for all the types of seizures, and it's not efficient against absence, and it has a lot of side effects. How does it work? It's blocking sodium channels. Okay, moving on. So talking about topiramate. Topiramate is useful against partial and tonic-clonic seizures. How is it going to work? It's going to block sodium channels, just like phenytoin, but it's also going to increase GABA action. So what are the side effects of topiramate? So we see sedation, slow cognition, kidney stones, skinny, so we're going to have weight loss. Sight is going to be threatened, okay, like glaucoma. Speech, so everything with S, sedation, slow cognition, stones, skinny, sight, speech, okay? Word finding difficulties. Okay, what do you want to remember about our drug topiramate? It's also used for migraine prophylaxis. So again, topiramate, blocking sodium, increasing GABA, good for partial seizures and tonic-clonic, sedation, and good for migraine prophylaxis. Valproic acid. So valproic acid is pretty much efficient against all seizure types, but not status epilepticus. So it's good for partial seizures, tonic-clonic seizures, and absence. How is valproic acid acting? It's going to have multiple things it's going to do. So first of all, it's going to increase sodium channel inactivation. It's going to increase GABA concentration by inhibiting GABA transaminase. And we can have GI distress as a side effect, and we can have rare but fatal hepatotoxicity. So remember that with valproic acid, we want to measure our liver function tests. We can have pancreatitis, neural tube defects, tremor, weight gain, and it's contraindicated in pregnancy. It's also used for myoclonic seizures, bipolar, and migraine prophylaxis. So you really want to remember valproic acid is also good in bipolar. And you want to remember that hepatotoxicity, triple mechanism of action, increased sodium, increased sodium inactivation, increased GABA, and inhibiting GABA transaminase. Okay, then we have vigabatrin. Vigabatrin is good for partial seizures, and it's going to increase GABA. We're going to have irreversible GABA transaminase inhibitor. Okay, vigabatrin is irreversibly inhibiting transaminase, GABA transaminase. Okay, so what can we have as a side effect? We can have a permanent visual loss and vision gone all bad with vigabatrin. So that's it for our anti-seizure drugs. I suggest you to watch the video multiple times and to notice like the little subtleties that are different from one another, starting from the mechanism of action to the extra uses that it can have, all the notes on the side effects that are noted with each one. Good luck!